Ovarian cyst types, causes, symptoms and treatment. Sometimes a cyst growing from an ovary on a stem can twist the stem on itself, torsion. This cuts off blood flow to the cyst through the stem and cuts off the cyst's blood supply. This can cause sudden, severe pain in the lower abdomen. Large cysts can cause abdominal swelling or press on nearby structures. For example, they can put pressure on the bladder or rectum, which can cause urinary symptoms or constipation. How is an ovarian cyst detected? Because most ovarian cysts don't cause any symptoms, many cysts are diagnosed incidentally, for example, during a routine checkup or when an ultrasound is performed for another reason. If you have symptoms that suggest an ovarian cyst, your doctor may examine your abdomen, and perform an internal, vaginal, exam. They may feel an abnormal swelling that could be a cyst. An ultrasound scan can confirm an ovarian cyst. An ultrasound is a safe and painless test that uses sound waves to create images of organs and structures in the body. A scanner probe can be inserted into the abdomen to scan the ovaries. A small probe is often inserted into the vagina to scan the ovaries for more detailed images. A blood test called the CA-125 test is often done along with an ultrasound. If this test is normal, your cyst is unlikely to be cancerous. A simple blood test by itself does not completely rule out ovarian cancer, but it can be accompanied by a benign cyst with an ultrasound scan. Some women may have other tests, such as a computed tomography, CT, scan or magnetic resonance imaging, MRI. This is not necessary for the most common type of benign ovarian cysts. May be helpful if ultrasound is inconclusive and or CA-125 is higher than normal. Operation. Ovarian cyst removal may be recommended, especially if you have symptoms or if the cyst is large. Sometimes a specialist may want to remove the cyst to determine exactly what type it is and to make sure it is free of cancer cells. Many small cysts can be removed by keyhole, laparoscopic surgery. Some cysts require a more open surgical approach with an incision in the lower abdomen. The type of surgery depends on factors such as the type of cyst, your age, and whether or not cancer is suspected. In some cases, only the cyst is removed and the ovarian tissue is preserved. In some cases, the ovary is also removed, and sometimes other nearby structures such as the uterus, womb, and other ovaries are removed. Your specialist will advise you on the options for your individual situation.